Thanks so much for joining us for this webinar, which focuses on urgent issues at a time when discussing the immigration system and immigration detention, I think takes on particularly additional significance in the midst of serious protests all across the United States and the world in relation to racial justice, policing, and issues that are very much at the heart of the movement to address the harms of immigration enforcement and immigration detention in this country. And I think it's a solemn moment to be talking about some of the most complicated aspects of this, which are the issues of health and the right to health in the midst of a global pandemic. So I wanted to just begin the webinar very briefly, and then my colleague Catherine at Physicians for Human Rights will say a few words of introduction as well, by situating this webinar and this discussion about health and issues related to health and detention in a system of detention that's a really sprawling and complex one. We'll hear more about this throughout all of the presentations, I imagine, but for those who are new to these issues and are joining this webinar to understand them for the first time, we have a system of immigration detention in the United States that stretches across a number of federal agencies and intersects with various state and local detention facilities. The primary detaining agency in the United States is Immigration and Customs Enforcement, or ICE. They currently hold about just under 26,000 individuals in their custody and care, but by and large, they don't do that at their own facilities. They do that in facilities all across the country, often local jails and prisons, frequently private detention settings. There are scores of individual detention settings across the United States where ICE is holding these detainees. And then in addition to ICE, we have individuals detained in the custody and care of the Office of Refugee Resettlement, again, often through contracts and relationships with other detention settings, the U.S. Marshals Service, which detains those who are being prosecuted by the United States frequently for offenses that are just linked to their immigration status. And not for any other reason. And then the Bureau of Prisons holds immigrants who are convicted of those or other offenses in specialized facilities. So, across this sprawling detention archipelago, there are tens of thousands of migrants in detention at any given time. For the statistics for this sort of introduction of just under 26,000, that really only addresses a part of that overall detention system, but it is useful perhaps to illustrate what an inadequate response the government has made. That the ICE notes that they've released only about 900 immigrants in sort of the post pandemic or during the pandemic, and have released only under 400 as the result of court orders. So, this is a situation where we have tens of thousands of people in detention. Those numbers have not been reduced because of releases. And so today we'll hear both about some of the medical issues as well as the efforts to address those issues. And now I'll turn it over for a few more words of introduction to my colleague Catherine at Physicians for Human Rights.
Thank you so much, Ian. That's a really helpful overview, talking about the different types of custody that family members or friends might find themselves under. And I'll just mention, Ian already mentioned to us that there have been just under 400 judicial releases, and that includes people who were released as a result of the litigation efforts of our colleagues who will be speaking on the second half of this webinar. But I just want to highlight a resource for you. For advocates, you'll be familiar with this, but for any friends or family, if you go to ice.gov/coronavirus, you can get all of the publicly released ICE statistics. So for example, today that includes 3,113 detainees have been tested as of yesterday. The total detained population is 25,421. and there are 818 positive cases that ICE has publicly disclosed. So if you want information about the current ICE numbers, and it also mentions facilities where people who are in detention have to, oh, thank you, Dr. Lopez has shared that in the chat as well, that link. So that's a helpful link. We are concerned that ICE is not releasing all of the numbers. There's a really good blog post out by Vera Institute of Justice today that says, listen, ICE hasn't confirmed how many people have tested negative. So some of those cases are still pending. There could be more people who were still waiting for their test results. So we don't know the full positive test rate, and that's concerning for us, but I think it's important for us to take advantage of the numbers that we do have and use those to have information about friends and family, the detention center they might be in, and also for advocacy. So I'd just like to mention that Cornell Law School, Cornell Medical School, and Physicians for Human Rights have been collaborating on providing forensic evaluations for asylum seekers for many years, and since the pandemic started, also providing some expert declarations for lawsuits, trying to educate judges about the risks that people can face due to the spread of the coronavirus in detention settings. And so at Physicians for Human Rights and Cornell, we were discussing back and forth what might be helpful, and we just really felt that it was critical for us to provide up-to-date scientific and medical information as well as legal information in a way that would be accessible for families, friends, and community advocates. So you are our audience, and we hope that this information will be really useful for you. And now I will turn it over to Gabriella, who will tell us about the Q&A feature of the chat.
Hello, thank you, Catherine, for that introduction. My name is Gabriella Pico. I'm a student at Cornell Law School, and basically I will be helping to moderate the chat, so there will be a couple pauses during the presentation where we're going to go over the Q&A, and I'll be monitoring the Q&A, and if I see any questions that really haven't been answered and are in line with what's being presented, I will bring those up in the Q&A. I also wanted to mention, if anybody feels uncomfortable asking a question in English, I'm bilingual, so if you prefer to ask your questions in Spanish, I can translate those to English to our panelists. Thank you.
All right, should we move on to the introduction of the first panel then?
Great.
Okay, great. Good afternoon, everybody, and thanks for making the time to join us this afternoon. My name is Basil Safi, and I'm the Executive Director for Cornell's Office of Engagement Initiatives. My hope is that today's panels will lead to new and powerful opportunities for partnerships that combine both the content and context expertise needed to engage community partners, advocates, faculty, and students in this important initiative. The first part of today's webinar is specifically designed to allow these prominent public health and medical experts, Ranit, Alan, and William, to provide an overview of COVID-19 and its relation to detention and safe medical release. So welcome everybody, especially the speakers. Dr. Ranit Mishori is a senior medical advisor for Physicians for Human Rights and a professor of family medicine at the Georgetown University School of Medicine. Dr. Mishori has been a champion of immigrant health for the past 2 decades through intensive engagement in various activities, including clinical care for refugees and asylum seekers, documentation of human rights violations, education, and scholarship on these issues as well. Dr. Alan Shapiro is the Senior Medical Director of Community Pediatric Programs and Assistant Clinical Professor of Pediatrics at the Albert Einstein College of Medicine. Dr. Shapiro is on the Executive Committee of the American Academy of Pediatrics Council on the Immigrant Child and Family Health, and has co-authored the Academy's policy statement on detention of immigrant children, in addition to many other related publications. Finally, Dr. William Lopez is a clinical assistant professor at the University of Michigan School of Public Health and author of the book, Separated, Family and Community in the Aftermath of an Immigration Raid. We're delighted to have the 3 of you here today and want to start with an initial question. Quite simply, what is the basic health information about COVID-19 and detention that families and those in detention should know?
I can take that question. I think families need to know that their loved ones in detention are at a higher risk for two things. One is for getting the disease itself, being exposed to it because of the setting itself and how the disease transmits in congregate setting, but also to know that certain profiles, medical profiles of their family members and loved ones may dispose them or predispose them to having more severe disease if and when they get it. So these are two very important aspects. One is how quickly it can spread in that setting and what the impact might be on the individual.
Thank you. Alan or William?
Other thing, since nobody's talking, I can add that you know, the medical facilities at those settings is important, and whether they're prepared to take care of potentially a large outbreak and in a disease, in the context of a disease that when some people get it can very quickly deteriorate into something that requires intensive care. So from my understanding of the and experience with the ICE detention facilities in general and immigration detention, those the resources are generally not there in terms of the ability of the medical team in the facilities to take care of people.
Great. Alan, please go ahead.
Sure, I could add a little bit to that. This is Alan. So I think a couple of things are really important to consider, and maybe some of this we can go into a little bit later, but you know, the first thing I always think about when we talk about family detention centers and children in detention is the trauma that preceded their detention and how vulnerable that makes them, especially at a time where everyone is so afraid. And so the impact on their mental health and their development, which is so critical for children, especially children who are spending long periods of time in detention, are so worrisome. And we could talk about some of those issues maybe later on, but more specifically to COVID, a couple of things I like to add to Ranit's points are that many of the families that we see in our program, Terra Firma, which is a program that is based in a community health center, and works with released families and unaccompanied children, is that many don't know their own medical histories because they really have lacked access to health care in their countries of origin. And so we find many patients who don't know that they have hypertension, might not know that they have type 2 diabetes, things that really put them at risk for severe COVID infection. So being in the detention center, like Ranit mentioned, and putting them at such higher risk for contracting the infection. Also, there's this added aspect of them not even knowing that they're at higher risk because they don't know their health care. They don't know their own health care profile in some cases. Then I'll just add, in terms of the risk that children have and the difficulties in maintaining the ability to prevent spread in the infection in detention centers that have children really are not even addressed by the CDC in their own detention guidelines. So when we look at the detention guidelines by the CDC, there's nothing written about children. And we know that children can't socially distance themselves. We know that they can't maintain wearing masks. We know that they mouth objects. And so they're really at a high risk of spreading infection. And just lastly, that we know that those children, children with no underlying infections have been the ones that have been most at risk for that very severe infection that some children get called multi-system inflammatory syndrome. So I'll leave it at that.
Yeah. Thank you very much, and bienvenidos a todos. My name is William Lopez. So most of my work in public health looks at the way immigration enforcement impacts families and communities, and one aspect of this is certainly detention. What I want to talk about mostly today, I do a lot of organizing as well, and I look forward to speaking with the folks who are also doing organizing so that we can think about how COVID is impacting us specifically in physical and biological ways, but also what are the social impacts it has and what can we do to work together, especially across disciplines, public health, medicine, organizing, etc. I'll speak up a little bit better. Thanks, Irene. So one of the things I think this has made us realize here is that there are many ways we study in public health to stay healthy. And one of them is social support, right? So we've been working with people who are detained and for all the reasons that were just mentioned, feel incredibly lonely, scared, and isolated, right? Appropriately so. And what we've tried to do is find ways to lessen that isolation. So for organizers, you know, what we've been doing is we had a letter writing campaign to get letters to folks who were inside, and we also found ways to put money on folks' commissary accounts so that they're able to speak to folks on the outside. What this has forced us to do is step outside of what we learned to focus on as disciplines and think more about how we can look at health from a broader perspective socially. And I look forward to the rest of the event talking about what we can do and the other social elements that end up impacting our health, especially in a time of COVID, and especially as undocumented or mixed status communities.
Great, thank you. Thank you, all three of you. We have a minute or two for a couple of questions before we move on. Do we have any one or two questions that we'd like to pose to the panelists before moving on?
Hi, Basil. I did see in the preliminary report Q&A, somebody asked, what is the incidence of children in detention contracting the virus? And are these children transferred to a medical facility or are they treated on site?
Any of our panelists care to answer that?
I think, Alan, you should take that. If not, I'm happy to take it.
Well, and Ranit, maybe you could talk about the incidents, but I think the thing that we worry most about is the responsiveness and the accessibility of healthcare services in the detention center, in the detention system. So that what we have seen in the past is that when parents present with their children with symptoms, they're not always taken that seriously. And sometimes that leads to more serious illness, which we have seen tragically over the last year and a half, with about 7 children dying in detention, not COVID related, but other viral like illnesses that have led to unfortunate outcomes. And so the other aspect is that in the 3 detention centers, which I visited all of for children, for families, there's no pediatrics, there's no pediatric specialists in these facilities. And we know that children are not little adults, and children have their own special healthcare needs and present in very special ways, so that it is concerning. It's very concerning to me and my fellow pediatricians that children are kept in detention because they really do not have access to the care that they need. And that goes, that would really pertain to the pandemic as well. Ranit, maybe you could just add a little bit to that.
Yeah, I want to add 2 things to this. One is to kind of follow up on children are not young, little adults, is that children present very differently. And what we know or knew of COVID for a long time, people generally thought of it as an infectious disease that affects the breathing or the lungs, the respiratory system. But we know that, number one, this is not what it is at the moment. It's much more of a multi-system disease, and that it presents completely differently in children. So in children, for example, if you're looking for the fever and the shortness of breath and the cough, that's not going to be the case. And in kids, sometimes it presents as a diarrhea or certain skin conditions, or not at all. So that is number one. And number 2 is because kids are not little adults and they present differently, they're not going to get tested because they don't have the classic symptoms. And we also know that testing in general around the country, and especially in places of detention, has been done miserably with shortages of all kinds of materials that are required for testing. So the bottom line is we don't know what the incidence is. I doubt that we will ever know what the true incidence is or the prevalence. And it's based on a combination of factors.
Great. Thank you to you both for that. I know we have another question from Stan that I wanted to ask if you to wait a few minutes, because we will be getting to that particular question about the transfers. But with that, Catherine, perhaps we can move on to some of the resources that are available for friends, family, and community sponsors of people in detention.
Yes, thank you so much, Basil. And I just want to take a moment for people in the webinar to kind of check in whether you're a community advocate or a friend or family member. You know, it can be very discouraging and hard to hear that actually, you know, the risks in detention or other types of federal custody are quite high. And, you know, it's basically not a situation that you can easily mitigate the risk to your, you know, to your family or friends. So I think that reminds us how important it is for people to be released, and that's really our shared commitment, and that is possible. And we are seeing hundreds of people being released. And so that's really the goal that we need to press forward with. And with that being said, I will just paste into the chat this resource, which will be translated into Spanish very soon. But it was developed between Freedom for Immigrants, Women's Refugee Commission, and Physicians for Human Rights, including Dr. Mishori, and it has guidelines on safe release. So if your friend or family member or, you know, someone that you're sponsoring is about to be released and you're wondering, how do I organize transportation? What do I need to do if I'm preparing the accommodation for this person? This document has very practical advice for, you know, supplies and steps that you need to take. So I'll, since Dr. Mishori developed this document, I'll ask Dr. Mishori to share with us some of the top, maybe the top 3 takeaways that you would tell to friends and family from this document.
Thank you, Catherine. I think that one of the reasons we developed it is because throughout some of the medical legal partnerships and the emergency litigation that we've been involved with, we've seen that both lawyers and sometimes ICE were saying, well, you know, is there safer? People are safer in the jail or in the detention center, which is completely it's a complete fallacy, of course, because of some of the reasons we discussed. So the question is, people are safer on the outside with their families and with their communities. So what do people need to know? What their communities need to know to facilitate this the release in a safe way? And I also saw the question about transferring people between facilities. That's the same idea as transferring them from a facility to the community. Without going into too many details, and you can look at the document, 4 issues that are important. One is, where are people going to go, especially if they have symptoms or if they've had symptoms or even if they tested positive, where are they going to go, and what kind of setup needs to happen to facilitate either isolation or quarantine. And most people need to leave and go into a 14-day quarantine. How do we coordinate with community-based organizations, especially with the healthcare system and with the Department of Health if needed? This is critically important to facilitate the provision of all kinds of community-based resources, from housing to medicine to food, etc. And then the bulk of it is, how do you protect the person who is receiving the detainee and the detainee themselves as they leave? So talking very, very practically about, what do you need to have in your car? How do you set up your car in a way that it prevents the transmission within the car? And how do you clean up, and what kind of masks and goggles and things that do you need to provide to the person as you're receiving them outside or after release? So it's very, very kind of hands-on and very practical, and I hope people can use it. And as Catherine was saying, it's going to be translated into Spanish very soon, so hopefully people and families can use that easily, and it's accessible to all through the internet.
Yes, and it covers different situations, as Dr. Mishori said. So people who've tested positive, people who haven't been tested, people who've been exposed, people who haven't been exposed. Can you pick them up from the facility? Do they need to take a bus? Do they need to take a plane? So these different scenarios are covered. I think just one more question, Dr. Mishori, and then I'll hand it over to Basil. But Ranit, how would you recommend that family or friends use this resource?
I think it's good to prepare ahead of time and know what to look for, know what the risks are. We talk about designating one person, so in order to minimize exposure to multiple people. And we recognize that this is a potentially very joyous moment for people anticipating the release of their loved one, but there needs to be they need to do that with a lot of caution and pre-planning. So it needs to be deliberate in order to minimize the risk to the family, to the detainee, the former detainee, and to the community.
But I do worry a little bit about this kind of like the school has to fix that.
Somebody needs to mute themselves.
Okay. Lovely, lovely. Appreciate that. Now, moving on, particularly for Bill and Alan, over the last several months, we've been working the amicus briefs, which you'll learn more about in the next half hour or so. But information change daily. New publications as COVID-19 is researched more heavily. There are new tools that are being developed every day. So when you take a look at this resource, what aspects appear to you as being missing that we as a public health, medical, and advocacy community can help contribute to?
Alan, I'm happy to go first. You want to go?
Sure. Go ahead.
Yeah.
Go ahead, William.
Thanks. So I think this is a fantastic resource. I was reviewing it before the session, so thank Dr. Mishori and everybody who put it together. Thank you so much. I'll share a story about my own family and how we've kind of coped with COVID here in Michigan. So my parents live about a mile away. They moved. My mom's from Mexico. We've lived in Texas my whole life, and I've lived here 10 years, and my parents finally came up here. So my parents are very excited to see I think the one who needs to mute, I think it's my partner in the background who's also on a call and also working. So I apologize about that. It's the challenge of sharing home offices, but I'll try to scoot up and be a little more aware. So I'm aware. Thank you. Thanks, Patrick. And so, we were telling my mother is happy to see her grandkids. And, I was as a public health professional making videos, making them in Spanish for my community and telling about 6 feet, wash your hands, things we know very well. And as I talked to my mother and she's looking at her grandkids, she always manages to put it in perspective. And she's like, well, the hardest thing is not being able to hug them anymore, right? And so what I found myself doing and trying to understand is some of the opportunities that this disease has to spread are because our normal gestures, perhaps they're cultural, perhaps they're familial, our normal gestures of love, we now aren't able to do, right? So we're not able to hug. For some of us, we're not able to shake hands. My parents can't drive my kids around in the same car because we're trying to distance. And I think what's so beautiful about this document is that we're able to say that we understand having the quinceañera with a lot of people in the room. This is how we show our love. But this is also how we show our love, right? Those are important milestones, and we will creatively find other ways to celebrate them because I also am able to show my love for my family by socially distancing and by washing hands. But until I was able to really understand the emotional element of it, I realized what I was missing as a public health professional. And so I think all of the practical advice that you gave here is incredibly helpful for me because I'm able to describe things that are very specific, right? So this is how we are showing our love to you, Mom. Your grandchildren are doing this. They're doing it by not getting in the car. They're doing it by washing their hands. And as we've kind of adapted, and grown, and this has gone on. My parents understand, my kids understand, and we understand. But the opportunities I've seen for spread in our community are those that are rooted in a gesture of love and celebration, celebrating the return of a loved one from a very scary place, right? And the more we can say that celebrating this return involves this responsible caretaking of each other's health, I think the more successful this will be. So again, thank you so much for this document.
Bill, I thank you so much for that sort of personalized way to approach this. I think it's really important to take that perspective. And I'm going to try to answer the question, and I'm not 100% sure I'm going to get to what you were asking, but let me see if this is relevant, or this is really what you're getting at as well. So one of the things that I am most concerned about for families that are released, and I also work with many unaccompanied immigrant children, is their access to healthcare and their access to, as you said, up-to-date relevant information. And one of the really terrible things, I think, that has happened over the last 3 years. This has been going on for longer than 3 years, so let me acknowledge that. But I think under this administration, the fear of accessing public services such as healthcare has really changed. And I think people who are, whether they're not documented, even if they are documented and worried about their ability to move their case ahead, are really afraid to utilize or access healthcare services. The consequences of this chilling effect is very significant always, but in this particular time of a pandemic, could have very tragic results. And I recently listened to a podcast of a Mexican family where two brothers died, I think within 24 hours of each other. One brother was turned away multiple times from getting the care he needed, and another was afraid to go because he was undocumented. One was documented, one wasn't. So I say this because, first and foremost, it is so critical for people to access healthcare services when they have those symptoms. Don't wait at home. It's easy for me to say, don't be afraid, but I really want to implore everybody to make sure your families, your friends, your loved ones get the healthcare that they need. And so the next question is really how you access and where you access those healthcare services. And I would say that, you know, in some places we know are much more friendly to immigrants than others, but I would say that if you have a public hospital or a charity hospital in your community, or know of folks that have access to immigrant-friendly healthcare services, really turn to those services. There's a whole network in the United States called Federally Qualified Community Health Centers, and their mandate is to provide healthcare services regardless of ability to pay, regardless of immigrant status. They're always on a sliding scale fee, oftentimes down to zero, so you have to pay almost nothing. And it is really important to try to access those services and understand, if you're an advocate, to have that network of resources in your hands so that you can give those to families, and that families don't have to wait to get the healthcare services that they need, especially if they're COVID related.
Great. Thank you both for that. And I know we've talked specifically around what families need to do when a loved one comes home for detention. And Bill, you spoke eloquently about what compassionate care or compassionate isolation looks like when somebody does need to be in quarantine. And a lot of that borrows from what we found in Ebola as well, which I worked on. But you know, what else do we need to know about loved ones coming home? Or related to Stan's question from earlier, the risk of transferring people between facilities without adequate testing and screening. Oftentimes status is unknown. So both from a home detention standpoint or in terms of the transportation between facilities or facilities to home, what kind of considerations do people need to be aware of?
I mean, I think people need to recognize that these kinds of transfers, anytime you travel somewhere, there is an increased risk to the person and to the community, which is why, you know, our state governments instituted do not leave home requirements, some are more restrictive than others. So that definitely increases your risk. So the question is, you know, how do you do risk reduction? How do you reduce the risk of transmitting it to somebody else or getting it en route? And that means that you know, sometimes the lawyers have to demand that transfers be stopped. So there have to be lawsuits against the entities that conduct the transfers, such as ICE, to stop the transfers because they're a hazard to public health. Sometimes, if that is impossible, we need to go to one level down and think about how do we do the least harm and how do we protect the people who are being transferred. And here I'm talking about both the people who are detained and also the guards and the driver and people who are involved in the transfer. Everybody is at risk. And the question of inequity comes in, you know, does the driver have a mask and gloves and goggles, but the detainee does not? Now, how do we weigh the available resources and how they're distributed to the people involved in the transfer? So there are multiple levels. At the very basic level, which is the provision of protective equipment, provision of masks and gloves, and hand sanitizer, that needs to be there. And if it's done without, if the transfers are done without it, that is not good for public health or for individual health.
Ian, can I add one thing to what Ranit said, which is there's an interesting concept of being tested and being tested negative. Even if you're positive, it's called false negatives. And some of the tests all the tests really that we utilize are not perfect. And I think what's important for families on the outside to realize is that if someone actually tests negative before they come home for the virus, it doesn't mean that they don't have it, and that quarantine should still be put into place so that people are safe, because the test might not have picked up the virus. It might have been early on in the infection. There's problems with the testing. So people come out tested negative, but they're actually positive, and they might feel well, because we know that a large percentage of patients, of individuals who contract COVID, have no symptoms or very mild symptoms. So they think they're fine. They think they're not infected. Their test is negative, but in fact they can be. So just to be very clear that people should still maintain, you know, that isolation for 14 days, just to make sure that their symptoms don't develop, so that they don't transmit infection. Ranit, would you agree with that?
Yeah, I have one other, absolutely, Alan, I think that's absolutely correct. And that's also that what we recommend is, regardless of whether they're tested or they show symptoms, to go into quarantine upon release. But the other thing that I wanted to mention that's a little bit more of an issue with transfers is that ICE has been saying that they're what's called screening people before they put them on a bus or before they move them from one facility to the other. The problem with screening, and screening is different than testing. Screening is not a blood test. Screening is asking a series of questions. And what I have seen in the cases that I've worked on is that the ICE screening relies on what we knew 3 or 4 months ago, or 5 months ago now in January, about the disease, which is, as I mentioned before, oh, you have to have a fever and a cough and shortness of breath. And if you don't, you're good to go. But in reality, we now know that this disease manifests itself in multiple different ways. Some people have headaches, some people don't have a fever, some people have diarrhea. And so from what I've seen, ICE is not screening people for what newer symptoms, or as we have recognized them in the past few months, are very common symptoms like loss of smell, loss of taste, skin rashes, and all kinds of other things. So those screening procedures that ICE is saying, oh, we're doing that, are really insufficient and will not capture many of the potential cases.
Okay, great. Terrific. Bill, anything to add?
I think there was a question above from Susie that was touching on what I believe you, Dr. Shapiro, mentioned, the chilling effect of folks wanting to avoid or worrying about treatment. And again, for the community advocates, and I think also for both the lawyers and physicians on the call, and Dr. Mishori's framing of risk reduction, I'd say, is actually what's going on in people's heads outside. And what we see is people are scared of reporting because they're getting tested, because they're worried about the government and they're worried about deportation. And they're also worried about their employer being told. So in reducing the risk, they're thinking that deportation is the worst, unemployment is the second worst, and maybe COVID is superior, is better than those other two. And I say that because these are really the reasons that we need to have our information and our facts straight, right? And for those who are doing advocacy, I would certainly say call your health department, ask them what the procedures are, ask them who will be informed. And for those of us who have been working with the health department, we know that they're not sharing medical records with ICE, and often communities can be reminded of that. But these are the kind of real life balances that we need to figure out how to explain when we're giving this type of information.
Very good. Thank you for that. We have a question from Hannah online, and I think we're going to touch on this in the next section, Hannah, but it's thoughts on what lawyers and clients can ask while people are in detention to give caretakers on the outside. So this is about, sort of the sharing of information, sort of across boundaries, as it were. I think we're addressing that in the second panel, unless some of the speakers have anything to mention about that, or more simply on the broader impacts of detention in the time of COVID-19, both on immigrants who are in detention, but also for undocumented, which I think is related to Susie's comment about, testing for people who are afraid of going into a hospital because of fear of being identified as somebody who's undocumented.
I think one of the issues with this disease is it's reportable and it's understood. It's understandable why it's a reportable disease. When you identify somebody in the community, you have to report them to the Department of Health because of the public health concern and how much of a big issue it is. And I think people are extremely worried that would mean that their immigration status would be disclosed as well. The other issue is also with in many locations, the drive-in. Their drive-in, things are changing as we speak, but at least early in the epidemic, there were some systems set up driving centers that were in the suburbs, which completely meant that urban communities, communities who are with a lower socioeconomic status, who may not have cars, couldn't access the testing, and that was at the time when testing was hard to get in general. So we have a situation where there's an inequity in testing, inequity in access, and of course the fear that both Bill and Alan were speaking about in accessing it, even if you have something in your neighborhood and in your area.
And I'll add one thing briefly on that, Basil, but for many states, undocumented folks still do not have licenses. So the idea about doing something that they can get detained for, to drive to something they can also get detained for, are multiple barriers. So it's positive to think, it's good to talk to your local health department about if it's a drive-through or if they can have a pop-up where folks can walk, so that those who aren't able to have licenses can also access it.
Great, terrific. Gabrielle, I know you've had a couple of questions come directly to you, and why don't you pick one of those for the panelists before we move on?
Sure. So we had a question about whether there are any resources and shelters for individuals who were detained but who are later released, because right now, in light of COVID, the person who posed the question said that they're having difficulty finding placement for people regardless of whether they tested positive or negative.
I can say that there are organizations that help with housing, which is something we are also addressing in the document. I can't give you, I mean, it's different in every state and jurisdiction. So, but there are organizations who are working on housing, who are working on finding places such as hotels or other facilities that would take people for quarantine or for isolation. So I think Catherine, correct me if I'm wrong, but some of those links are in the document, right?
Yes, there are some resources. There are a number of post-release services, and I know this is a challenge when we're talking about people who don't have sponsors or family members, or maybe if sponsors are reluctant to take someone on who has tested positive. But I do think our document also, our resource also shows ways that even if someone has been tested positive, that the preparations that can be made in that accommodation to make sure that it's safe for others who are there. So I think that's something that I would highlight. But it is a challenge, and I think that's something that's coming up. Some of these challenges, maybe we don't always have the answer, but that's something we're working toward as a community. So thank you for highlighting that critical issue of housing.
I think, this is Alan, I think it raises a very important issue that we found in New York City is many families that are released oftentimes end up doubled or tripled up with other family members, and it becomes really untenable. as everyone knows, the reasons why financially and other forms of stress and just plain overcrowding. In New York City, we find that many asylum-seeking families are entering the family shelter system, and the family shelter system in New York is open to anyone, regardless of immigration status, and it does offer them access to housing. If they're families, they can enter the family shelter system, where oftentimes, really always, will have what will look like a private apartment, even if it's in a facility that shares kitchen and maybe some bathrooms. And then there's the hotel program in New York City for those who are known to have contact with COVID but can't maintain isolation. And I just wrote to one of my colleagues to see if that applies to anyone, regardless of immigration status, unless someone on the call knows that.
Thank you for that. Thank you for that response. I know it's a tricky issue with a lot of moving parts associated with it. So my last question before we move on is, and this is in part because of the majority of we have about 15% of students who signed up for this are people who signed up are students. We have faculty, we have community partners. So as we think ahead to the coming year, how can community partners, faculty, and university students all come together to advance synergies around community engaged teaching, research, and programs to support detainees and advocate for policy change? So again, what's that perfect marriage between university inclusive of faculty and students, community partners, and legal advocates? Are there models that you've seen working successfully, or is it something that the institutions on the line can actually strive for over the coming months?
I can say that there are multiple, and I think maybe this is going to be discussed later, multiple medical legal partnerships that are already operating, and certainly some that have strengthened and enhanced their activities since this crisis unfolded. And I can't stress enough how important it is to involve community-based organizations and make sure that this is where the knowledge, the questions about what needs to be done, the questions about what needs to be researched, it all comes from the community and not from the university kind of top down, but really from the bottom up. And this is, it's always a challenge across all kinds of disciplines, but I think that at least in my university, and I know that others, and I know at Physicians for Human Rights, we're making an effort to partner with community-based organizations, with people with lived experiences who can inform not only our research, but also our service provision.
Thank you. Bill and Alan, for your institutions, any evidence of community engaged learning or steps to achieve that over the coming months?
Well, I would add the National Center for Medical Legal Partnerships is an organization that really brings healthcare professionals together with legal professionals, and that even though they've focused less on immigration in the past, they're focusing more on the needs of immigrants now, and I think that's one resource that might be available. I don't know if that's exactly answering the question. The other group that I know that's bringing together healthcare providers with lawyers that are working on behalf of immigrants in detention is New York Lawyers for the Public Interest. I know some of our own providers have been writing affidavits and reviewing medical records to assist in getting adults out of family detention settings. Interestingly, the American Academy of Pediatrics has a very, very active group of pediatricians that are very active in the immigration advocacy space. Many of us are writing affidavits for children. I'll just bring up an issue. One thing that we've been seeing during COVID is that children who are unaccompanied end up in the Office of Refugee Resettlement custody shelters, which is different than the ICE detention centers. One of the issues we're seeing is delay in release, especially of kids from New York who are in the New York detention centers. And what's happening is those children are aging out. And when they age out from very child-friendly shelters to adult detention centers. And we've been very active in having to write affidavits to either prevent children from going into those centers by having them released sooner, even during this time of COVID, or for children who have been then transferred into ICE adult detention facilities, some who have had very, very serious mental health problems, to be released. And it's those children often that have very complex healthcare issues or that are the hardest oftentimes to place, especially if they can't identify a sponsor. And so American Academy of Pediatrics has worked very closely with the Office of Refugee Resettlement. We have a whole network of to connect Office of Refugee Resettlement with pediatricians to help connect them to services in the community so they can get released more quickly. The answer is a little bit more complicated than that, but if anyone's interested, I can give more information.
Great. Thanks for that, Alan. And in the interest of time, maybe Catherine, you could wrap up and begin the introduction of the next panel group.
Yes, thank you so much, everyone, for your engagement. I'm seeing we still had a few additional questions regarding testing and screening. Dr. Niyogi wanted us to remind that a positive test should always be considered, should never be considered a false positive. And we have a few other questions that maybe we can address in a follow-up email, but thank you so much to our experts. You know, this is sometimes very discouraging news, but you know, what we need to have is the facts, and then we can take action based on that. And we need our policies and our you know, everything about the way our government is operating to be impacted by, you know, the public health and evidence-based medical facts. So thank you so much for sharing those with us. And now, taking that knowledge, we'll move into the second portion of the webinar, which is hearing from our legal experts who are leading some of the most critical cases right now that are getting people out of detention and you know, really taking a step forward in terms of human rights in our country. So here's the lineup. We have Eunice Cho, who's the Senior Staff Attorney at the ACLU National Prison Project, and her work focuses on challenging unconstitutional conditions in U.S. immigration detention facilities, as well as the expansion of immigration detention. And she's leading ACLU's litigation response to COVID-19 immigration detention at the moment, and recently co-authored a report entitled Justice-Free Zones, Immigration Detention Under the Trump Administration, which we definitely recommend reading. It tracks the expansion and worsening of conditions of immigration detention under this administration. After we hear from Eunice, we will also hear from Lisa Graybill and Maya Fleischman, who are the Deputy Legal Director and the Law Fellow, respectively, at the Southern Poverty Law Center, as well as Elizabeth Jordan, who is the Director of the Immigration Detention Accountability Project and the Civil Rights Education and Enforcement Center. And all three of those panelists, Lisa, Maya, and Elizabeth, are all counsel in Freihat versus ICE. Then we'll hear from Neha Desai, who is the Director for Immigration at the National Center for Youth Law, who is counsel in Flores versus Barr. And finally, we will hear from Gregory Copeland, the legal director, and Sarah Gilman, legal director at the Rapid Defense Network. And they are counsel in OMG et al. Versus Wolf, and a number of other cases. So with that, I will turn it over to Ian to moderate the second half of our webinar.
Thanks so much, Catherine, and all. It's really fabulous to have these wonderful legal minds together to share for those with family and loved ones in detention some of the developments from the legal cases. And what I thought we would do is start with a discussion with Eunice about the work of the ACLU, and perhaps you can provide us a little bit broader sense of the landscape, and then we can drill down and hear a bit more specifically about some of these other important cases, and then go to a Q&A. So Eunice, would you like to start us off by sharing a little bit about how lawyers are fighting to get people out of detention and improve conditions, and sort of what's the record, or what's the state of the success that they've had so far?
Sure. Well, I just wanted to say thank you to Cornell and PHR for organizing this panel, and it's really exciting to be part of this conversation. So many of the folks on the medical end have been incredibly helpful in terms of supporting the litigation with expert declarations and providing information about the health risks that come up in detention, and also really exciting to talk with folks who have been litigating these issues around the country, because it is, given ICE's resistance to releasing people on a wide scale, it is taking an all hands on deck approach to get as many people out as quickly as possible. We first launched, at the ACLU, launched litigation around COVID-19 and immigration detention in March 2020 as local governments and then the federal government began to issue shelter-in-place orders related to COVID-19. It's not that long ago, but of course it feels like a lifetime ago in another sense. And I think the inspiration for the litigation really came up actually when reading an ICE press release in early March when COVID started to hit. And so at that point, I know that many of us in the prison and jails world, advocacy world, and in detention world were thinking about what we knew was going to be a terrible disaster when COVID hit in those facilities. And there was also, I think, some brewing thinking about how to prepare things like parole materials for parole petitions for detainees. And I remember reading the ICE press statement at the time, and it said, ICE only has authority to detain individuals for immigration purposes. ICE cannot hold any detainee ordered released by a judge. And at that point, it became very clear that litigation to release people was going to be necessary. So a week later, we filed our first case challenging the detention of medically vulnerable people in ICE detention in the Western District of Washington in late March 2016, and because Seattle was the first hotspot for COVID in the country. And since then, we have seen a wave of litigation around the country requesting the release of immigrant detainees due to COVID-19. And we've been proud to just see how this has resulted in the release of people and the establishment of very good case law with respect to how this violates Fifth Amendment due process rights for detainees, and how courts have the authority to release people on the basis of dangerous conditions in detention facilities. And this has been, I have to emphasize that this has been in response and in support of the broader movement of detainees and families, advocates, and organizers who are all fighting for the release of people from detention. And I also want to point out that this work has an analog in the prison and jail context, right? Because there are clear parallels between the work happening in immigration detention and those our allies working in the mass incarceration context in terms of the fight to free people from prison and jail in the context of COVID-19 as well. The litigation strategy is really premised on the argument that the government has the duty to keep people in their custody safe under the Fifth Amendment's due process clause for immigrant detainees. And this includes safety from serious illness and death from communicable diseases like COVID-19. And so our strategy has been premised on the need to release the maximum number of people possible from detention in the quickest time possible, given what we know about the spread of COVID-19, especially in circumstances like detention. And our public health experts advise that people who are medically vulnerable, who are most seriously at risk to serious illness and death from COVID-19, should be among those who are released first. And so while we also know that facilities must do what they have to do to improve cleanliness, provide soap, hand sanitizer, make sure that there's social distancing, we really believe that the most important thing to do is to release people from detention quickly, especially those who have a high likelihood of death. Thus far, the ACLU, we have filed over 51 cases nationwide, including 10 class action suits. My son is about to join me. Litigation brought by the ACLU and its affiliates. We've been responsible for about 420 people being released as a result of court orders or ICE discretion. And we know that many other cases around the country have also resulted in the release of people. you know, at this point, the number of people detained by ICE is actually at the lowest point in over a decade. This is, of course, we cannot take credit for this reduction in numbers. It's also largely in part due to the shutdown at the border. So, you know, the failure to admit new people to immigration, ICE custody at all. But it is helpful to look at the numbers in terms of the fact that the Trump administration last year detained an all-time high of about 56,000 people in detention. And as of May 23rd, 2020, the detained population is around 26,000 people. So substantially less than, much more than half number of reduction. We have a number of class actions pending, and I know there's others in the country that directly request the release of many more people from detention. So we hope that we can help to secure the release of many more people from detention in the near future.
Great, thanks. And you know, one of the things, because of the goal of providing information to families and loved ones, as well as sponsors might be receiving folks from detention, would be to hear a little bit about what can families or loved ones share with those in detention or can be doing on the outside to support litigation or to contribute to this movement?
Well, I mean, that's a great question. I think part of the question is also what can our litigation do to support families and people on the inside? Really, that is the mode and the reason for this work. But in terms of just trying to kind of help ease and help the process in terms of identifying people who should be released from detention quickly and gathering the information that's needed. I think it is always very helpful, especially in light of the enhanced barriers to communication with people in detention. You know, ICE has used the COVID-19 crisis and in justifiably, you know, to help stop the spread of people, you know, limiting the number of people who can come into the facility, but it has also made it much more difficult for attorneys to communicate with clients in detention and have access to people in detention. So, you know, having contacts on the outside who can serve as a third party, who can, you know, provide important information necessary for litigation, including medical information, records, identifying release strategies. You know, if detainees have a family member or community members with whom they can be released to safely outside, that's important. We also really want detainees to be able to document the conditions so we can put that information in declarations. You know, how is it that you're not able to protect yourself in detention? You know, are there people who are sick and have wanted tests, but that, you know, can't get them? Are there people being transferred into the facilities? Are guards and other people wearing masks and protective equipment? You know, is it possible to actually, you know, socially distance and practice good hygiene in detention? I think those are really important. That's important information that's critical for courts to know about, and you know, if detainees can identify that information is very helpful. I think the other thing is, you know, connecting with local organizing groups and immigration lawyers and advocacy groups who are working to push and amplify and build resistance to what's happening in these detention centers is incredibly important. And I think, of course, you know, being in touch, that's very, very hard right now. But I think trying to maintain, to the extent possible, lines of communication is incredibly important right now.
Thanks so much. And it's a question we'll hear about from the other litigators as well. And we'll move on now and come back in the Q&A to some of these topics, but move on to the next group of speakers, well represented, and we're grateful for the team joining. And that's Lisa, Maya, and Liz, who will tell us a little bit about the Freihat case. So what I'd love to hear from is similar sorts of questions. You know, what is your case and work seek to do? You know, what's the status, and how have things developed so far? And then, you know, we can circle back, but would love to hear more about who's helped and how folks on this call or who have loved ones on the inside can contribute to these efforts.
Sure. This is Lisa Graybill from SPLC, and I'm going to start, and then our co-counsel Liz Jordan will speak, and so will Maya Fleischman. So very quickly, we're counsel in a case called Freihat versus ICE, which was filed well before COVID was on anyone's radar back in August of 2020, to challenge what we all know to be the abominable medical and mental health care conditions across ICE's system of facilities. Specifically, we challenged the inadequacy of medical and mental health care treatment, the abusive and excessive use of solitary confinement, and discrimination on the basis of disability on behalf of a putative class of all the immigrants detained at the approximately 158 different detention facilities that sprinkle across the country, whether they're run by ICE directly or run by, whether they're a local jail working in contract with ICE or run by one of the private prison providers. As far as we know, no one had tried to sort of bring an overall case against ICE before to say, your failure to adequately implement and ensure standards are enforced in your facilities results in a substantial risk of harm to everybody who's in detention, because you have no mechanism for ensuring that proper care is consistently available and the detainees have access to it. We did point out in our pleading that ICE, this is not optional, the Constitution and federal statutes require this, and but in comparison, ICE is certainly not required to detain all the people that it does. And our argument is basically that if ICE is going to try to detain this many people, it has to provide them adequate conditions. And of course, our hope is that ICE will choose simply to detain fewer people, and we're trying to put a squeeze on the system that way. It was filed in August of 2019 in the Central District of California in Riverside, but it is a nationwide or systemic case. And we have 15 named plaintiffs at 8 different detention facilities. We filed it with the intention of impacting the way ICE manages medical care, mental health care, solitary, and disability across all facilities in the country. With that, I'll turn it to Liz.
Thanks, Lisa. And I think that background is really important to what we're about to say with regards to coronavirus. Because as Lisa mentioned, and as some of the doctors mentioned on the first panel, we're starting from a place where ICE can't handle routine medical care. They can't handle medical emergencies of other sorts. We've seen rolling outbreaks of chicken pox and measles and mumps in the detention centers. And so, nobody was inclined to give ICE the benefit of the doubt that they would be doing it right when it comes to this pandemic. So, bearing in mind the fact that we'd already alleged all of these problems in ICE detention, and we had a set of class representatives who were vulnerable to serious complication or death if they caught coronavirus because of the underlying medical conditions some of them had that we were already complaining about. In March, we decided to see if we could take some emergency steps in our existing litigation to try to force a systemic response from ICE to the pandemic that was clearly sort of bearing down on people in detention, and sort of trying to carve out a spot to talk about the systems to leave room for folks like Eunice and the other litigators who were litigating more individual cases or more facility-specific cases. We think that our case is a complement to that. So in early April, we filed asking our same judge in Riverside to please certify a class, actually 2 classes of people who are medically vulnerable either on a constitutional basis because of the unacceptable risk of harm under the 5th Amendment that Eunice mentioned, or that they were discriminated against by being placed at such risk, which is illegal under Section 504 of the Rehab Act, which protects people with disabilities. And issue some emergency injunctive orders to force ICE to try to clean up its act. So on April 20th, the judge ruled in favor. So he certified both of those classes, and Maya in just a second will show you some more detail on where to find the language of the orders. And then he also issued a preliminary injunction requiring ICE to do 3 things. The first is to properly identify everybody in their custody who has a risk factor. And notably, the judge bought our argument that there are certain risk factors in detention that are different than risk factors in the general population. So for example, our age for advanced age is 55, where the CDC recommendation is 65. Our judge also included psychiatric illness as a risk factor, which the CDC, I think, still has not spoken to, but studies are increasingly showing that that is a risk factor. And we also know that ICE, because of their poor record keeping, because of their poor, their understaffing and their inappropriate use of lower level medical care, professionals and those sorts of things, they miss a lot of people's diagnoses. And so, you know, the first step in this order is to really properly sort out who has a risk factor. The second step, according to our judge, is that ICE, through its own administrative review process, once it has identified somebody, needs to consider whether continued detention of that person is appropriate. Calling that a custody redetermination review under Freihat, and we have, you know, been recommending to people that they affirmatively request that to ICE, which we'll talk about a little bit more in just a second as well. And the reason for that is because, you know, we also argue that the public health consensus is the safest place for somebody in this pandemic is to be sheltering at home in community, not left in the detention center. And so release is the mechanism, you know, obviously to accomplish that. However, our judge has also taken sort of a third step, which is that, you know, we recognize that ICE is not going to open their doors to everybody super willingly and let everybody out. And so the judge has issued orders regarding the conditions in the detention centers for people who remain detained in ways to try to mitigate their risk of harm while they're in the detention center. So that's what he ordered. I'm going to very briefly say where we are right now, and then I want to give Maya plenty of time to share with folks sort of concrete ways to get their loved ones involved or get them help. You know, so this order came down on April 20th. ICE has been extremely recalcitrant. I would argue being a bad actor. They have taken the absolute minimum approach to all of this. And so we have also already subsequently filed and received an order from the judge ordering that they begin to provide us with information so that we can properly monitor and ensure compliance with the order. In that follow-up order, the judge noted that they were being lackadaisical in their systemic response to coronavirus. They continue to be lackadaisical at this point. And we are figuring out ways to you know, raise ongoing issues with opposing counsel and then potentially back with the court in the very near future. So with that, I'll turn it over to Maya.
Hey everyone, my name is Maya Fleischman. I'm a law fellow with the Southern Poverty Law Center. Can you all see a screen that says Freihat ICE Community Resources? Great. So like Liz mentioned, although ICE has the burden to follow the order and start evaluating people to release, there's a lot of issues wrong with their whole system when it comes to medical care. So we're encouraging people to file their own Freihat requests. And there's 3 ways to do that. One being that pro bono attorneys can do it, or their existing immigration attorneys, any really attorney can do that. And we think that's a very effective way for, you know, for ICE to reconsider their request for release. So if we have a toolkit on our SPLC website, and I will drop that link in the chat after I'm done speaking. But here you'll find a bunch of resources that I'll just quickly go through. So like I said, one of the ways that we are encouraging people to file reconsideration requests on behalf of folks detained in ICE custody is by submitting a client letter, a custody redetermination letter. So we have a template that we posted. And, you know, basically a lot of the word is already in there. The wording is already in there. If you have medical records, great. If not, we're still encouraging people to submit the letters. So that's one way that we've been encouraging. And through the Creek, Creek set up a pro bono volunteer with the action. So if you're interested in volunteering, SPLC, Creek, and Disability Rights Advocates, who's our co-counsel as well, have been hosting trainings once a week for our pro bono attorneys, and everyone is set up with a mentor that helps them through the process. So that is one way that we are encouraging people to submit Freihat reconsideration requests. And, you know, after people submit the Freihat reconsideration request, we ask that you email us, and I'll drop the email address that we set up. And that's how we are ensuring that the court is following, that ICE is following the court's order. So really our primary purpose is to, as Una said, just get as many folks released as possible from ICE custody. And then, secondary to that is that we're also gathering evidence on how much ICE is actually complying with the court's order. So based on a lot of the evidence that folks have been submitting to us, we've been bringing it back to the court and saying that, where ICE is really failing to comply with the court's order, specifically by field office, because some field offices are worse actors than others. A second way that people can help is that their sponsors can also submit a release request pursuant to FREHA. So here we have like a step-by-step instruction and how to submit, and we're actually just got that translated into Spanish and will be posted on our website. And then lastly, we have for people to submit pro se release requests. This is a little bit more challenging. What some people have been doing is, for example, here in Florida, like visitation groups have been mailing copies of these requests. So, folks that are detained can go ahead and submit one in the box that they have in their dorm that's labeled ICE. However, what we prefer is for people on the outside to submit requests because we believe that ICE is more likely to actually look at them. We know from a lot of people from the inside that ICE rarely checks the box with the requests. You'll also find on our website the preliminary injunction and the subclass certification order, so you can go ahead and see if your client or your friends or your family maybe falls under one of these risk factors. And lastly, we also have key quotes from the judge's decision posted and frequently asked questions, resources like that. And we have a notice to court order. We have that translated into 10 languages total. We're adding a couple more right now, but those will be posted in detention facilities all over the country soon. We're also setting up, so that notifies people whether or not they're potential class members or they're class members, and they deserve, or they are entitled to a custody redetermination request by ICE. And lastly, we are in the process of working with ICE to set up a hotline so our class members can call us for free. We have people working the hotline every day to respond to our class members and help them through the process. I don't know if I left anything out, but I will be dropping resources in the chat. So if you're interested in volunteering, or if you know family, friends that are interested in submitting FREHA redetermination requests, that you can look into it. Thank you.
Thanks so much. Now we'll move on to hear from Neha about the Flores v. Barr case.
Great, thanks. And I'm going to actually start, I'm going to share my screen and just share a few slides here. So give me one moment. Is everybody able to see this?
Yes.
Okay, great. So I'm going to start by backing up a little bit, since Flores is a case that spans decades and decades and was not filed recently in the context of COVID, but of course our most recent active litigation has been focused on COVID. The population of kids that I'm going to be speaking about right now are children that are unaccompanied. The Flores settlement agreement, actually, I'm sorry, I'm going to start with this slide to share a little bit about the Flores settlement overall. So this case was actually filed back in 1985 when a child named Jenny Flores and a number of other children were found in a kind of makeshift detention center that the government had set up, commingling children and adults, absolutely no education, no child-specific provisions or accommodations whatsoever, no accountability. And the case was filed to really challenge the procedures around detention, treatment, and release of immigrant children, all immigrant children, and I'll break that down in a moment. So this was actively litigated up and down the circuit courts, up to the Supreme Court, and settled in 1997. with the settlement agreement that we are currently still living with and actively litigating. At this point, it is the only real mechanism that allows for regular oversight, access to children in detention facilities, the ability to interview them and ensure that the government is complying with the provisions that they agreed to back in 1997. So I've listed here a couple of the different protections that are born in the settlement agreement. But for purposes of our conversation today, I mean, what is most important is really the thrust of this agreement is that children are released as expeditiously as possible. So they get out of custody quickly, but while they're in custody, they're treated appropriately. They're in safe and sanitary conditions. They are in facilities that meet their needs. About 5 or 6 years ago, there was very active litigation where the government was challenging essentially who this settlement applies to, because when it was originally drafted, there was a very different population of children in federal immigration custody than there has been over the past few decades. And the government wanted to take the position that really this settlement only applies to unaccompanied children. So unaccompanied children are the population of children that arrive at the border under the age of 18 without a parent or legal guardian and ultimately get transferred into the custody of the Office of Refugee Resettlement. So they are under the custody of Health and Human Services. Now there's also a population of children that come with their families, and they come through, all children first come through Customs and Border Patrol, but accompanied children often get transferred with their family members into ICE facilities. So thus far, the litigation that's been discussed is really focused on children in ICE and adults in ICE facilities. But I will be focusing a bit more on the children that are unaccompanied and that are in the custody of the Office of Refugee Resettlement. So one thing that I wanted to mention as well before I get in too far is that there are kind of several bodies of law that really govern the rights around unaccompanied children. So one is the settlement agreement that I'm talking about right now. The Trafficking Victims Protection Reauthorization Act is another really critical body of law that speaks to what unaccompanied children are entitled to. And then of course the Constitution is kind of the framework that governs all of this. But in the context of litigating Flores, we are really only able to address, as our judge likes to put it, the four corners of the settlement agreement. So we are not able to make broader legal arguments about the rights of our class members outside of the Flores settlement agreement. So we have actually also filed separate litigation that I won't be getting into in detail today, but litigation that kind of expands the body of law protecting these children. So once children are transferred to ORR facilities, and there are over 100 facilities spread throughout the country, and there's a range of the type of facilities that children are held in. They're at the least restrictive level. There are actually facilities that are essentially like foster homes, and then there are more restrictive facilities. There are several levels of increasingly restrictive facilities. Some of them are residential treatment facilities that serve children with special needs, and then there are staff secure and secure facilities, which are just juvenile detention centers. So there's quite a range, and the treatment that children experience varies broadly depending on where they are. So there have been, as I mentioned, kind of a number of different challenges within the Flores litigation over the past several years, but kind of getting to where we are currently with the litigation around COVID, in March, or kind of early to mid-March, we started hearing a lot of reports in New York in particular, where of course things were really hitting a crisis level proportion. So the children that are detained in facilities in New York, we were hearing from lawyers there telling us that they were very concerned about the lack of measures that OR was taking within the facilities to ensure that children were not being exposed. The fact that there were, at that point, even in early March, several confirmed cases of staff who had tested positive, and yet they were not being quarantined, children were not being quarantined. But moreover, and Dr. Shapiro mentioned this earlier, that the larger issue that there were many, many kids in custody, not just in New York, but certainly there and elsewhere, who did not need to be there. So children that are unaccompanied are generally in some stage of the process of having the government determine whether they can be released to a sponsor. So historically, the majority of these children had family to whom they could be released, and the government has taken, at times, has taken 20, 30 days to go through the process of evaluating how long of whether a sponsor is appropriate, but then over the past year, we've seen that number increase to almost 60, 70, 80 days before, on average, they are releasing children. So we were hearing of more and more children that could be released, but were not being released, and very conflicting information about whether COVID was actually a basis for not releasing, because some facilities were taking the position that if a staff member had tested positive, that they couldn't release the children, whereas our medical experts who provided declarations in the TRO that we filed testified just the opposite, that there were many, many safe ways to have children released, even in facilities where staff had tested positive, and in fact, it was much safer overall for everyone's benefit for these children to be released. So we filed litigation back in March 26th, and we've had 4 different hearings before the judge. Now, the litigation impacts both accompanied children and unaccompanied children, but since we have attorneys from OMG speaking particularly about children in the family residential centers, I will leave that portion to them. When we first filed, there were no confirmed cases of children who had tested positive, but a number of staff that had tested positive in various facilities. And the judge in the initial hearing felt like that we had raised a number of issues demonstrating that the government was not releasing kids promptly and not complying, particularly on the ICE side, with their obligations to keep children in and families in safe conditions. So she initially ordered a number of, she asked the government to produce data, individualized data for every single child in custody. And just in terms of numbers, I should say, and others have mentioned that the numbers of kids in custody have dropped dramatically, both because of the border closures, but even before that, there were a number of measures being taken to restrict children from entering. So whereas almost a year and a half ago, there was as many as 14,000 children in OR custody. At this point, there's only about 1,500. Of those, about 900 are in congregate care facilities. So one of the positions that we were taking in our litigation was, well, of course, first and foremost, children should be released expeditiously, but when they can't be released, children should be moved from congregate care facilities to the more individualized foster homes that I had mentioned earlier on. And that would further reduce the population so that social distancing and other measures could be taken in congregate care facilities. Just to speed ahead, because we've been through a number of different rounds with this litigation, kind of where we are now. I'm sorry, actually, Ian, would you like me to pause there and ask a follow-up question, or do you want me to jump to kind of where we are now?
No, it'd be great to hear sort of where we are now, and then we'll hear from the last panelist, and we can open up to a broader discussion among everyone. So that's,
okay, perfect. Thank you. All right. So where we are now, in her final order, which was on May 22nd, she found that the government was continuing to fail to comply. I think Liz had mentioned their lackadaisical and kind of recalcitrant approach, particularly on the ICE side, and that is absolutely the case. ICE is continuing to detain accompanied children that should be released. On the ORR side, the government has found that, the judge has found that the government is providing the data adequately that she requested in terms of individualized determinations as to why children are still there, why they haven't been released to their sponsors, but she continued to express frustration that they were failing to comply with her order, which her prior order had ordered the provisional release of certain categories of children. And in the report that the juvenile coordinator submitted pursuant to her prior order, they admitted that they had not provisionally released any children. So I think Dr. Shapiro mentioned earlier on the situation around kids that were aging out of ICE ORR custody into ICE custody, and this is something that is of grave concern to us. And there was one particular youth who was a client of a legal service provider based in Chicago, and that client had a child that was going to age out 4 days later after our hearing when we submitted this declaration, and that child fell into the prior order and should have been provisionally released but was not. And so the judge during our last hearing ordered that child be provisionally released. And that's the first time she's really taken that step. She also continued to require certain pieces of data that the government must produce, but really stressed that that ICE can't provide this meaningless data that they have been for the past several months, and that they first have to meet with the special monitor and ensure that the individualized information they're providing as to why each child who's in the family residential centers continues to be there is particularized and is not just generic information on which she can't really make a determination about compliance or lack thereof. She also increased the monitoring efforts that Dr. Paul Weiss and the special monitor, Andrea Sheridan-Orden, have so that they can really investigate what's happening in the family residential centers. She also required that the parties meet and confer in June around how families in family residential centers are being advised of their rights. And she acknowledged the extraordinary unnecessary emotional turmoil that was inflicted on families as ICE allegedly tried to comply this last round over the past few weeks. So we have a status conference coming up again in June, on June 19th, and she indicated that we would continue to have status conferences essentially throughout the pandemic to ensure compliance. So I will pause there and happy to answer questions later.
Great, thanks so much. And we'll move on now to hear from Sarah and Gregory, who are counsel with co-counsel in the OMG litigation, but also counsel in other important litigation in this area as well. And the same questions, Sarah and Gregory, and Neha, you can stop sharing your screen when you get a chance, that tell us a little bit about what your litigation is trying to do and what the status is, and how those on the phone who might have loved ones in detention could be helped, or what they could do to support your important work.
So I'll give a brief overview to begin with. So Sarah and I run a small organization outside of in New York City. We do federal litigation nationwide. During the COVID pandemic, we've sought to just accelerate what we typically do, which is partner with community organizations, people that are directly impacted by ICE's conduct, and sort of build a litigation team around that, exploiting all the sort of resources that everyone else is talking about. A lot of the first panel have helped us out, including, Dr. Shapiro, Dr. Keitzel, we've used some of your other declarations, and so we really appreciate that. But so RDN's approach has generally been to rapidly respond to whatever we're seeing ICE doing in an inclusive manner that allows us to level the playing field, including as broad of a group of the different populations that we've been able to work on behalf of during the crisis. So, we filed 4 big cases during the crisis, including the OMG case, which is on behalf of all families in family residential centers. This is one of the first and big cases filed during the crisis, in between the ACLU's case and the Flores filing. The OMG case was filed, and so that was on behalf of approximately 1,400 families or family members that were detained at the 3 family residential centers, ICE, baby jails, 2 in Texas and 1 in Pennsylvania. So that was the OMG case, and then subsequently we've also filed cases on behalf of all ICE detainees in the 3 detention facilities under the under the new Miami field office, which is approximately, I think, 1,400 adult detainees. We've also filed a case on behalf of all transgender detainees. I think I got a dog in the background, but so we filed, that was on behalf of all transgender detainees in ICE detention across the country. Unfortunately, we got a bad decision on our TRO and our class certification 2 days ago. And then finally, which I think, could be a case that sort of expands from here, is we filed a case on behalf of approximately 200 plus mothers and children that are detained in Dilley Family Residential Center or Southern Texas Residential Center, Dilley, and the Berks Residential Family Detention Center. And that case seeks to prevent removal, given the fact that the removal process is so unsafe. The removal process involves a number of sort of the vectors that we've discussed here as being vulnerabilities, transfers. It's got, diverse groups of people coming from all around being grouped together in close proximity. So, while the whole detention system is deadly, and in our view, deadly not just if you have underlying conditions, it's sufficiently life-threatening that no one should be exposed to this, regardless if you have a high risk of dying or not. Such that was our such that the final effort in ICE's efforts to remove people, deportation, can be sort of the most deadly and the weakest. Any weak link in these chains exposes people to harm, such that we've successfully prevented the deportation of these 200 plus mothers and children for this period of time, because the process is not established to be sufficiently safe. I'll let Sarah go into sort of the details of our cases in the first instance. You're on mute, Sarah.
Sorry, guys. Hi, everyone. So as Gregory said, we filed the OMG case very early on. We actually filed it March 21st, and it sought the release of all families in these 3 detention centers. We initially got an order from the court that said the parents, so their families in detention, so some of the children, or all the children, are covered by Flores, but the parents were not protected by that. And so that the parents essentially had the same rights as the children, in this situation. Since that order was enacted, the government's had to file a number of different updates to the court. I think the litigation has proceeded, like many of these cases around the country, where the government comes in and says everything's fine. The amazing clients and advocates on the ground have done an amazing job of sort of amassing the evidence to go back to the court and say, no, not everything is fine. And the court in OMG is very much tracking the timeline of Flores. So I know counsel for Flores just previously stated that they have another status update or hearing on June 19th. And I believe that our next report is due on, or the government's next status report is due on June 19th. So the judge is very much tracking what's going on in Flores. And then we have another status conference on June 26th. Most recently, the government took a pretty aggressive approach, or I guess pretty standard approach for them, to move to dismiss the lawsuit, incredibly relying on the evidence that they have amassed since our lawsuit was filed. So we're going to be, defending that. As a result of the lawsuit, we have had people released from detention, which has been a positive. And I think that also, it has brought, I think the lawsuit has brought to light the situation for people in family detention. Dr. Shapiro, who has graciously donated his time to that case, and also the case that Gregory mentioned, where we seek the stay of deportation of families in Dilley, has been working, with a group of other doctors for a very long time to highlight the already pretty, terrible conditions for families in these centers. And so we hope that through this lawsuit, it gives a voice to those who, are continue to be detained in these centers, and hopefully as the litigation goes on, we hope that more people will be released. I think that, in thinking about who we have helped, which I know is one of the questions, and I think Gregory can talk to that a little bit, and then I'll just briefly say what I think we can, what can be done to further support what families can do and what the community can do.
So what did you want me to cover, Sarah? Sorry.
Okay, I think I actually covered. I said who can be helped. I think it's the families who are in the 3 directions.
Yeah, I mean, look. Our goal is our goal of all of our litigation is to help anybody that's in ICE detention. So what should families do? Families should keep pushing to get their family members out. I mean, this whole process over the last 2 months has been really demoralizing. That there wasn't sort of a broad consensus effort to reduce the prison populations, it's sensibly across the board. But I think you should be a squeaky wheel. You should not sort of, these. I think the success we've seen in these litigation efforts, a lot of the success that, from my view, has been finding ways of building upon cases that already existed and sort of, modifying them and using the COVID crisis as a way of, magnifying an issue that already existed. I mean, Flores existed before, Fry had existed before, one of our only directly successful cases was, pre-existing just Zedvitas prolonged detention habeas case. So, I think that there's a lot of need for people to push for this work. There should be there's a huge demand for it that there's not the need to meet. And that's really disturbing, I think, for everybody on this call, whether it's like because there's not enough people to be doing this work or because there's not enough people to help out your family members. But I think people need to keep pushing this stuff. I mean, the idea that it's justified for the government to expose people to, a deadly virus on the basis of a civil violation is absurd. Sadly, like we haven't been as successful in our litigation efforts as we have been, but like Freihat's telling you, keep records, keep the evidence. Like that's helpful no matter what, however you attack this. But yeah, I would, I think that everyone just needs to keep pushing. We keep losing, we win. We keep losing, we win. And we just need to keep, unfortunately, keep at it.
I was just going to add, for the community, I think it's really important. I think that COVID-19, as we're all talking about, just further highlighted the problems that have existed for a very, very long time in detention. And often people in detention, as we all know, who are, listening or participating in this webinar, just have been I don't want to say ignored, but their voices are not heard, I think, as much on a continuous basis. And I have been very encouraged by the outpouring of the medical community in particular in really banding together and adding the critical evidence that we need to be able to present this case. And I think it's, a time when you can think about changing the narrative, or all of us changing the narrative and helping to say that it's not only when COVID-19 is hitting this community, it's always, like, the people in detention always need to be represented. There's tons of issues that lawyers can certainly continue to litigate, but we also need, like, the community support, as Gregory was talking about, and for families to keep pushing to highlight this. And and particularly in OMG, I just even putting together that case and looking at the work that Dr. Shapiro and his colleagues had done, starting back, I think in 2014 or 15, Drs. Allen and Dr. Rich. So that would be my endpoint on that.
Great, thanks so much. Before we open it to a broader Q&A, I just wanted to see if any of the panelists from the sort of second segment on the litigation matters wanted to jump back in to comment on anything colleagues have shared. And we'll give a minute or two for that, and then my colleague Gabby will lead us in our Q&A more broadly. So anything from the other litigation teams or further reflections before we shift even more broadly? Great. Well, we can certainly continue to reflect on this in our broader Q&A. But Gabriela, if you'd like to lead us now in a broader discussion, we've got about 16 minutes before the webinar will end, and folks can share questions in the chat. And thanks so much, everyone, for this discussion. We'll open it up and feel free to pose questions that both implicate the litigators from the second part of the discussion or the medical experts from the first portion.
Thank you, Ian. So currently nobody has sent me any questions through the chat, but I do have the list of questions from the registration. And so we'll start with those. So somebody asked, have there been any COVID-19 related updates to the public charge rule? So I'm not sure if any of you feel particularly ready to speak to that. So I'll just open it up. Nope. All right. We also have a question about obtaining medical records from the detention facility. Somebody asked about, you know, what is an efficient way to obtain a client's medical records? I've seen different policies and procedures depending on the facility or the deportation officer. Not sure if anybody has an answer for that.
This is Liz. I can take that quickly. The answer is it's all over the place. It really varies quite widely. Most places need some sort of signed written release, but who you direct that to and whether they want it on their own like company proprietary form, how long they take to get back to you, and you know whether they are particularly responsive is totally all over the place. So unfortunately, it's a massive mess trying to get medical records, and I don't have any silver bullets to offer.
Yeah, it is. I mean,
oh, sorry.
Go ahead. Go ahead.
No, I just wanted to add that having seen some medical records that have been obtained, they're very, there are chunks missing. The quality of reporting and documentation is very poor at times. So even having them doesn't mean that you're going to get some good details there.
Yeah, I mean, I would echo that. I think that, you know, it is going to be detention center specific. I think that to the degree that you can, you know, you can keep submitting the wrong form, to the degree that you can put it on ice to tell you what you actually have to do, either as a fact point to prove in litigation later on, or as, you know, actually on the path to resolving getting your medical records. But, you know, I think that it's difficult for all the reasons that have been echoed in different, you know, ways on this call.
Thank you guys for those answers. I did just receive a question in the chat, and somebody is asking, they say, we focused on ICE and ORR. Is there anything more, litigation or otherwise, related to CBP, U.S. Marshals, or BOP that panelists can share?
I'm glad to share some of the work. I know that here at the ACLU, we've also been litigating cases along the same lines of the work that we've been doing in immigration detention facilities to release people you know, in light of COVID-19, and have filed a number of lawsuits around the country in U.S. Marshals and BOP facilities. One case in particular has gone up, the government has appealed a really good order from the Sixth Circuit up to the Supreme Court last week. The Supreme Court denied certiorari to that petition, allowing it to go forward. It'll go back up probably again soon. But, you know, I think unfortunately, I think in the prison and jails context, it's a little bit more challenging to prevail on these types of challenges in terms of release, partly because of the prison PLRA, the Prison Litigation Reform Act, which was passed in 1996, which makes it much more difficult procedurally for prisoners to bring these types of claims. And so those claims have been kicked out because of lack of exhaustion. in a number of cases. And so that is particularly difficult. And I think, despite the fact that immigrant detainees and people who are prisoners who are being incarcerated are held in virtually identical conditions, often at times the same facilities, there is a distinction in terms of the legal regimes, which is, I think, bearing down in terms of courts' willingness to actually release people on behalf of COVID. That said, there have been, some important steps forward in terms of improvement in conditions of confinement with respect to COVID-19. But it is by no means, enough to protect people who are imprisoned in both BOP, U.S. Marshals custody, and local prisons and jails, as we know that the death rate is incredibly high in these facilities, as is the infection rate.
Thank you, Eunice. We also have, I'm sorry, go ahead, Greg.
Yeah, we also have a case for somebody who was in BOP custody who had an ICE detainer, and we used he got granted compassionate release for the last part of his criminal sentence, and we used the threat posed by COVID-19 to him, given his medical issues, and the fact that he would have been subject to ICE's alternative to detention policy or deferral of enforcement actions pursuant to its March 18th order, to get his detainer lifted and to enjoin ICE from arresting him pending his release from criminal custody to serve the remainder of his quarantine period at home. So we've used that, kind of to get people in criminal custody outside of, home and safely sheltered without the transfer to ICE custody and exposure to risk, at that level.
Gabrielle, I just looked up really quickly the question about COVID and public charge, and on the SCOTUS blog, it looks like this did go before the Supreme Court. This was challenged and was actually turned down. So basically right now there's no pause from the Supreme Court for public charge during the pandemic. I don't know if this is from April, the end of April, so I don't know if that's been updated, but as of now, it looks like from this information that there's no pause from public charge even during the pandemic.
Thanks for that, Alan. And I think we'll be getting to our last question here. So Bob is asking if anybody on the panel can discuss how to best present an argument for a temporary restraining order and some strategies for seeking habeas for persons who are not in the high-risk category. And that's kind of a big question, but if anybody would like to tackle any part of that. Okay.
This is Eunice. There have been some cases that we have brought on behalf of people who are not necessarily in the medically vulnerable category. And that has occurred mostly after there has been positive case law in a particular facility and district on behalf, clarifying that the court has jurisdiction to actually release people for these reasons and that conditions in the facility are particularly bad. I think it is a much more difficult argument to bring up a case individually, especially where, a person does not have known, medical risk factors for COVID-19, kind of absent to those conditions. It has happened occasionally, but very rarely. And in the cases where people without medical vulnerability have prevailed in different opinions, it's really been where it's been set up where the court has been amenable to a case that's been brought in kind of a class posture where it's looking at a broader kind of de-densification claim and a depopulation claim. And that's when we've actually seen people successfully released, even when they're not part of medically vulnerable category. I think that's kind of the broader analysis that we have had. And I think we've ultimately, in terms of those folks, have been able to succeed in getting those folks released.
This is Sarah from Rapid Defense Network. I would just say in response to that, we actually brought a case very early on in Florida on behalf of an individual detainee who didn't have any underlying medical conditions. There were no positive cases in the detention center where he was detained, but there was certainly plenty of evidence. Thank you to all the doctors who, really spoke out very early on that the storm was coming. And of course, we had a very helpful decision out of the Central District of California by Judge Terry Hatter. I think that that particular, issue has always been really important to push. And I think that while the litigation that is focused on the medically vulnerable people is understandable, I think that we also want to continue to make sure we're pushing the legal arguments for everybody in detention, because our health experts have made it clear that COVID-19 interacting with the already systemic problems in a detention center makes it, I forget the exact words that Dr. Allens and Dr. Rich used. I think it was a tinderbox scenario. So I think that it's really important to think very broadly when we're bringing this litigation, and not to, and that's what I think all of our litigation, that's not what I think, I know all of our litigation has really tried to focus on.
All right, well, thank you guys so much for taking a stab at that big question. And we'd like to be sort of cognizant of the time. And I think unless Ian has anything else to add, that'll wrap up our questions for now.
Yeah, maybe just one more question. We've focused in this last section about litigation efforts and what folks can do to complement or partner with those litigation efforts. And I wonder, kind of broadening it more and thinking about both advocacy more generally and the expertise that we've heard from in the first panel, if there are other strategies for keeping pressure on immigration detention officials in any of these systems to put pressure for release, whether there are specific avenues for those on the phone or participating, that actions that they can take in addition to supporting the kind of advocacy to promote individual release or support these litigation efforts, at this time. Anyone want to share a little bit about what folks might be doing? I think certainly we've seen some efforts to pressure state officials to limit custody transfers from criminal justice authorities or prisons to ICE or immigration authorities. Those are things that people can either put pressure on their governors or legislators by calling the legislators. We've seen some of the groups on the call and others engage congressional oversight entities in Washington. And so folks can be writing to legislators in Washington, asking them to put pressure on ICE and ask them questions. I don't know if any of the panelists have other suggestions, but then we can maybe turn it over. And Catherine, perhaps you might share some final words.
Ian, one thing that pediatricians have been doing has been working with the professional organization, American Academy of Pediatrics, to really push the academy to be writing amicus briefs or just specific letters. Recently, with the binary choice that was given to families in detention, that they can release their children to a sponsor or stay indefinitely as a family together in detention. Was just outraged the pediatric world, and a very harsh letter was sent out to DHS on that. And oftentimes they're doing these letters in conjunction with the American Academy of Family Medicine, with AMA, with the American Psychological Association. So I think anyone in the audience who works for professional organizations, it's really important to push that as an advocacy, these issues as advocacy issues for their organization.
Thank you, Dr. Shapiro.
Thank you so much for that, Dr. Shapiro. I've just shared in the chat a PHR e-action which is sort of an example of the kind of advocacy that Ian was just mentioning. And there's also an active amnesty and PHR state level action in about 10 states, which if my colleague Hajar is here and has links and wants to put into the chat, that would be great. Otherwise, maybe we can email it out. But yeah, I do think that's a really critical way for us to end the this webinar today, which is to remember that just as we have medical and legal professionals working together for release, we also have different levels of oversight and authority that we can leverage to ensure that people can be released into safe conditions. So I think this is just the beginning of our conversation, and I know I'll be seeing many of you in future webinars and joint advocacy actions. So I hope we can move forward and use this webinar as just another springboard for joint action. And I really want to thank our panelists, and thank you so much, Cornell, for hosting us and organizing this great webinar.
Thanks, Catherine. Thanks, Physicians for Human Rights, and all of the panelists for your time and expertise. And thanks for those who are participating. And this is a really scary time to have a loved one in detention. We hope that this has been a useful discussion and that some of the resources we've shared could be helpful in relation to your family member or loved one. So thanks, everyone, and have a safe and healthy afternoon or evening.
Thank you.
Thank you very much.
Thank you. Bye, everyone.